nationally. I think I have to say we're talking at the moment about our first one. I think the first one we should try and keep within Newcastle. I think that would be for the best. I think though that if there were two sites and two centres within a national service, it would be important for both centres to grow and develop together, and I think that trust would grow out of that.
Thank you, Peter.
Okay,
Thank you very much. Hi, Joe. Nice to see you again. Joe, I've known you for many years, but won't you explain exactly what you do and how you've come to be involved in face transplantation?
Well, Derek, I've worked in plastic surgery for well over 20 years. I've been working as a consultant for nearly 15 years, and my interest in plastic surgery has been in microvascular reconstructive surgery. And I became interested in facial transplantation surgery a number of years ago while I was doing work with my national association, the British Association of Plastic Surgeons, and I organised a major international conference in Manchester in which I invited all the teams from around the world who had done most of the facial transplants at that point, and that meeting was held in 2011. And up until that point, there had been a lot of talk within the UK about setting up and doing a setting up and running a face transplant program, but that had actually never really happened. And I'd hoped that by inviting these other teams from around the world, we would develop some momentum and get the process going. And the momentum has gradually been building over the last 3 or 4 years. To the point now where there are several teams working much more closely together in an attempt to set up a service that will be both cost effective and sustainable for a UK population.
You feel now that the time is right to re-explore face transplant in a national forum. What do you think the need is currently nationally?
I think the need for a population the size of the UK would be similar to that of France. And they started doing facial transplantation in 2005 and have now done 8 facial transplants that I'm aware of. 7 of them being done particularly in one unit in Paris led by Laurent Lantieri, and their population size is not dissimilar to that of the UK. So I would envisage that once our transplant program is up and running, we're talking about very small numbers, but potentially 1 or 2 cases per year.
So, although the need is not great, what do you think is required from a unit trying to invest like ours? I mean, how much infrastructure do we need? Do you think we have enough? Do we need to invest in more infrastructure? Do you think we have an expertise in Newcastle just to start as soon as we get the go-ahead?
Well, there's clearly a lot of difficulties around setting up a facial transplantation program because the ethical approval was granted by the Royal College of Surgeons to do it in the UK in 2006, and it still hasn't happened. And I don't think it's just an infrastructural problem, because clearly a unit like Newcastle has the infrastructure to do this kind of work. It has the expertise, it has the team structure, it has the facilities, but there are much more difficult problems that we need to overcome, particularly in relation to organ donation, location of patients and organ donors, funding, and who will fund this and who will pay for it, and in order to make it sustainable. And of course, the teams that will do the work are already working extremely hard within their NHS commitments in lots of other areas within plastic surgery and reconstructive surgery. And so in order to provide a sustainable program, you need a reasonably large team of surgeons who are available on an on-call basis. And in order to achieve that, I think we need to work collegiately with colleagues in other units around the country who are also interested in doing this kind of work in order to make it work and make it achievable.
Okay, so you mentioned about the issue of donation. Can you explain actually what, if people consented to donation, what they'd be consenting to donate?
In terms of what families would be consenting to donate would very much depend on the patient who requires the transplant. That may be a soft tissue transplant only, such as skin and muscle. It may be a partial face transplant, like the first case that was done in France in 2005. It may be much more complex than that and require hard tissue element, and what I mean by that is the bony structure, such as the jaw, the upper jaw, the lower jaw, the nasal bones, and so on. So it very much depends on what the problem is that we're trying to solve for a particular patient.
So if I was a donor family member, and I was saying, well, I'm happy to donate the face, but what would I expect to see after the donation? How would I be shocked by what I saw, or would you manage to deal with that? For example, put a mask on, or how do you make that acceptable to donor families?
Yes, the issue around donation is there are lots of complex issues. One of them is that very question about how the family will feel about having facial structures removed from their loved one. And in order to deal with that, we will have maxillofacial technicians who will make a mask-like structure to go over the donor's face after the facial structures have been removed. And that is part and parcel of any facial transplantation program, and it's a standard practice.
Moving on to the actual procedure, we just talk about some of the indications, the potential recipients. Where would they come from? What types of injuries or what types of diseases?
Most cases in the world have been done on trauma patients, but there's also an increasing shift in the thinking about also using facial transplantation for patients who have other problems such as congenital or developmental abnormalities. But predominantly it would be trauma patients, and those patients could either be patients who've sustained burns or patients who have had significant injuries such as military explosions to the midface, gunshot injuries, significant injuries as a result of road traffic accidents, in which the deformity is not just a visual deformity, but is also a significant functional deformity for the patient, where they can't speak, they can't swallow, they can't breathe properly. They very often have tracheostomy tubes in. So these particular patients appear to do well from facial transplantation, at least in the relatively small experience that exists worldwide with these particular patients.
So Joe, in terms of the procedure, how long does it take, and what kind of expertise is required and has it got specific elements to it which require different types of surgeons to do, or can one person do it?
In terms of the expertise to do this type of procedure, you certainly need a team of surgeons. You need a team to harvest the organ from the donor, and then you need another team to get the recipient patient ready for receipt of the donation, and then to, if you like, plug it in. And in terms of time, that can take, it's quite variable, but they can take a considerable period of time to do these procedures. The problem is the length of ischemia time, that you need to keep it as short as possible in order to achieve a successful vascularized outcome to the transplant. And that, in order to achieve that, you need to have a very well organized setup in order to make that work.
So you speak about ischemia, ischemia meaning not enough, when there's no oxygen going to the tissues. How long can the face, muscle, skin survive without oxygen?
In terms of survival time before revascularization takes place, you would ideally want to have the transplanted part revascularized within about 4 to 6 hours, if at all possible. Once you start running over very long, prolonged periods of time of ischemia, you then run into problems where you cannot get the tissue to reperfuse after you join up all the blood vessels. And that becomes a real problem. So the shorter you can keep the ischemia time, the better.
So Joe, other than the skin being perfused with blood and looking nice and pink, what about function? I mean, would the muscle function be good? Would you have muscle tone? Would all this, for example, the jaw, would that move in the same way as a normal face would?
Function afterwards very much depends on, first of all, what type of tissue you've transplanted. And if you've transplanted muscle, you need to transplant nerves and get nerves to be joined up to the existing nerve structure. And that takes a long time for that to start working again. It takes a considerable period of time, and you've got a lot of swelling and a lot of edema, and that takes a long time for that to settle down. And a lot of physical therapy is required afterwards to help rehabilitate these patients. And even apart from the physical rehabilitation, there's a huge amount of psychological rehabilitation for these patients. There's really very little point in doing a complex facial transplantation if you cannot, or we cannot, rehabilitate this patient into a normal social environment, because many of these patients do not live a normal, what we would regard as a normal social life. They're very often isolated from their local community. And if by doing a facial transplantation we are unable to rehabilitate this patient socially as well, then we will not have achieved anything for the patient.
Okay, so Joe, the million-dollar question, when you have a face transplant and someone's donated their face, the person receiving that face, do they look like the person who donated the face?
In terms of what recipients look like after facial transplantation, there was a lot of concern before facial transplants were done that patients may look like the donors and that this would be very difficult for donating families. There was a lot of research and computer modeling done on this initially, and the general feeling was no, that this would not be the case. There may be some elements of the transplant which would make the recipient look a little bit like the donor, but in actual fact the reality of that is now, with over 20 facial transplantations done around the world, is that that is not the case and doesn't appear to be really an issue. So it's not as big a problem as people were worried about or concerned about in the past.
What's important in matching the donor and the recipient? What do you, as a plastic surgeon going to do this procedure, want to look for when you match a donor to a recipient?
In terms of matching, you're looking for, obviously, compatibility in terms of trying to reduce rejection as much as possible, because skin in particular is what we call very immunogenic and allergenic.